My name is Deirdre Conway, and I am one of our board-certified fertility specialists at the Utah Fertility Center. We appreciate that you are trusting us with your care, and we want to give you the very best chance of success. This is designed to give you a glimpse at the clinical process and what happens behind the scene in our cutting-edge embryology lab, a part that is crucial to your success but not seen very much as you go through the process. Don't worry about remembering any of this, because you'll hear it many more times as we walk you through each step. At this point, you've met at least one of our physicians at a new patient consult. One of us will be a ringleader, so to speak, making decisions and monitoring you during the cycle. You may not see your doctor at every visit, but rest assured we are always monitoring your progress. After we take a detailed history to come up with a plan that's individualized for your unique situation, an IVF coordinator will be assigned to help you organize your cycle all the way through. It's good to remember that there are many different protocols, medications, and doses, and all of these factors will be tailored for each patient. Once you start the medications and the monitoring, you'll be seen by our team of experienced nurse practitioners and ultrasound technicians. One of the first steps in preparing for IVF is starting on birth control pills within the first few days of getting a period. Being on birth control pills may seem counterintuitive when trying to conceive, but they synchronize all the little follicles in each ovary so that when they grow, they mature in a nice group together. Not all protocols will use birth control pills. Sometimes we skip them or use alternatives to the pills, depending on what we feel is best. A water ultrasound is also done in preparation for IVF and is usually performed during the time when you're on the birth control pills. This procedure serves two purposes. One, it's a trial embryo transfer to ensure that a small catheter can pass easily through the cervical canal. The second purpose of the water ultrasound is to use the catheter to infuse a small amount of saline into the uterine cavity, allowing us to see the entire contour of the uterine lining, ruling out any irregularities such as polyps or fibroids, which could interfere with implantation. This procedure is very brief and involves minimal discomfort. Now, there are just a few other steps to ensure that your start of your IVF cycle is without any surprises. Blood work is done for both partners, like infectious disease screening, to ensure the safest environment for your embryos to grow and the healthiest pregnancy. Egg reserve blood work is also done to choose the most ideal IVF protocol and doses. A recent semen analysis should be done to plan for optimal fertilization. Your IVF coordinator will be helping you to coordinate all of this, so don't feel overwhelmed because they will also be there to answer questions throughout the process.